Then I go to the next speaker, that is Sophie Kemper, who will introduce us in her PhD research on the public engagement in public health, emergency preparedness, response planning. It is not precisely from the World Packet 6 studies, but it is a lot of, I think, cross-fertilization that we have within our department that we are very happy to give you the floor to explain the public engagement of that. Thank you.
Yes, thank you very much. Hi everyone, my name is Sophie and thank you for the opportunity to present my results here. 3.5 years ago, I started with my PhD and I want to start this presentation off with a quote actually of one of my first study participants. And it goes as follows. As part of our culture, we try to control every aspect of life. This COVID-19 is so unpredictable, you can even be infected without knowing. It affects both young and old and comes with many uncertainties. Blissful uncertainties, as I like to call it. Finally, there's a break from control, and I'm not sure what we will gain from it. A crisis like this equals both danger and opportunity. So this was actually quite an elderly participant. So he was at risk for COVID-19, but he had a quite positive outlook on the crisis and wanted to use this quote because in my PhD project, we also use this crisis as an opportunity to learn more in my field of topic, which is public engagement in the management of COVID-19. So as I stated before, 3.5 years ago, I started off with this PhD project together with my team, whose names are stated here below, from the National Institute for Public Health and the Environment and the VU University Amsterdam. So we wanted to research whether it would be valuable to integrate the perspectives, the opinions, the views of citizens in the Netherlands more into the decisions that are being made in how we control a crisis like COVID-19. And why would you want to do that? So, as many of you probably know, when the decisions are to be made in COVID-19 management, there's always a trade-off that has to be done. So on the one hand, for example, you have accessibility to your healthcare facilities. On the other hand, you have mental health, mental wellness of your citizens. And with each decision that you have to make, considerations have to be done. At which way is the scale going to tip? And at this moment in time, or especially also during the beginning of the COVID-19 pandemic, these decisions or the considerations were mostly done by experts, healthcare professionals, and policymakers. And in the end, citizens of the Netherlands had to accept the measures and also sometimes execute the measures or the decisions that are being taken. And within this public sphere, we also saw a lot of dissatisfaction with COVID-19 policy. We have seen a lot of demonstrations, petitions, also people, citizens mobilizing themselves into groups in order to have their voice be heard and how they think policy should change. And we thought, okay, is it also possible to find a manner how we can take the consideration of the citizens and use that to integrate it in the decisions that are being made in COVID-19? Would it be valuable? How can we do this? So it was really an exploratory study that we did. And today I will present some of the results, 3 of the research projects that we did and the results that we found. And a little bit more of a background, we really looked at this topic, at public engagement from the perspective of the citizens. So we asked the citizens, how would you think public engagement could be valuable? How do you think as a citizen that it could be executed? And I will tell you something about the focus group discussions that we did, survey, and lastly, interview project. So first of all, the focus group discussions and the survey. So these focus group discussions, we held them 3 years ago, and we asked Dutch citizens about their general view on public engagement. And the results of these focus group discussions, we used it, amongst others, to create a survey and ask people about individual preferences, because thinking about engagement in general is something else as really wanting to be engaged in decision making. And a little bit of the method to give you a context of the results that I will tell you something about after this slide. So we did 7 focus group discussions with a variety of Dutch citizens in June and October 2020. And the survey, it was an online survey with a representative sample of the Dutch population, around 5,000 participants in October 2021. So what did we find? In the focus group discussions, people had a rather positive dispositions towards public engagement. So they thought it would be very valuable to engage the public more, as this would create a feeling of being listened to, which was important for them. And this would lead to also a decrease in public unrest, according to our participants, and also less dissatisfaction. They also thought that the public could come up with new ideas and also a better translation to the day-to-day lives, for example, measures. And when being engaged, they would have a better understanding of policies. And here I present you some of the results of the survey. So in this survey, we specifically asked participants, do you yourself would like to be engaged in the decision-making about these 4 non-pharmaceutical interventions? And as you can see, around 50% of our participants said that they did not want to engage in these decisions. And around 25% of the participants said, I don't know, or had a neutral disposition towards engagement. And the other 25% said that they do want to be engaged in making decisions regarding any of these 4 measures. And after this, we asked them, why do you not want to be engaged? So for the people who do not want to engage, their reasoning was they had a lack of knowledge about these non-pharmaceutical intervention. They had a lack of need for engagement in general. And also they said, well, the measure or the non-pharmaceutical intervention, it doesn't really impact me on a personal level. So I'm not really feeling, I have a desire to be engaged. So that is also important to take away. And for the people who do want to engage, so the 25% who did want to engage, they said, I want to be engaged because it would increase my understanding of the measure, it would increase my trust in the government, and also the quality of the measure would increase. Okay, next up is my final project that I want to share the results about with you. So this was a little bit of a sidestep. So in this project, we did interviews. And as I mentioned in my introduction, also during this pandemic, there were citizens mobilizing themselves into groups, into citizen initiatives or grassroots movements, or as we call it, civil society engagement practices. So groups of citizens that were taking action themselves because they were not content with the COVID-19 management as it was at that moment. So we, in this study project, we identified these practices in the Netherlands and also looked at their perceived contributions. We interviewed them, or we interview mostly the founders of these practices. So again, the method, we used mostly online databases of news articles and also social media records. And in the end, we included 22 practices. And we invited all these practices to participate in an interview. And in the end, 14 practices participated in interviews. So now, next up, the results. Well, this is a word cloud to give you a little bit of an overview of the characteristics of these practices that we interviewed or included. So mostly we're focused nationally. Some focus were, for example, on risk groups, presenting the needs and the priorities of risk groups. Some were focused on children, on schools. You see nightlife, the hospitality industry, so really a spectrum of different kind of initiatives wanting to contribute to COVID management in their own topic. And you can also see that they took different kind of actions. So they did campaigning, they did social actions, they did information provision, also petitions, letters to the House of Representatives. These were the activities that they undertook in order to create a change or let their voices be heard. And next up, the motivator. So we asked in the interviews, what are the reasons that you, as a founder, established this practice? Because there's, of course, a sense of frustration or a sense of a need in why people set up or mobilize themselves into an organization like this. So first up, founders told us that they organized because of a sense of solidarity. There's, of course, a national crisis or a pandemic, as you will, happening. And they wanted to contribute to that. They wanted to help. Furthermore, they also had a perceived lack of action from the government, especially at the beginning. So they thought, okay, then we will do it ourselves. Now, more towards the conceptualization of emergency management. Sorry, EM is short for emergency management. Some initiatives were established because they perceived a lack of democratic values. They perceived that there was not enough room for opinion forming preceding the decisions that are being made. And they thought, we have to make room for this, so we will do it ourselves. And they also perceived the lack of expert and societal diversity in emergency management. They thought that the decisions are mostly taken by experts, people who know a lot of emergency management, more of with a background in infectious disease control, and we need more experts with a more cultural perspective or more psychology perspective, you name it. So that's where they would stand up for. So next up, my conclusions after these 3 study research projects. We think that the voices of society that you hear, it contains a message overall. So there's a certain discrepancy between the needs and the priorities of citizens and the needs and the priorities that are considered in emergency management, which is also, of course, what we saw in the setup of the reasons to set up these practices. And when you listen to these voices, maybe a little bit more, you can make management policies that better align with the needs and the priorities of the citizens in your country. We also saw that there's a need for engagement in specific population groups. So not everybody wants to engage. There's a certain group that want to engage. And they said it would create more understanding of policy making, more of an exchange in views and ideas, and also the trust in institutions would go up. And now for my last slide, these of course is more of a conceptual side of public engagement. And I always get the question like, how would you engage the public then? So that is also something that we touched upon in this project. We asked our participants, well, what would your preferred mode of engagement actually be? And they told us it would be consulting. So citizens can contribute by expressing ideas or their views on certain elements or certain dilemmas that the government is, for example, facing, or certain questions. They have a guarantee that this contribution will be heard. However, it is non-binding. So they think, okay, citizens should not make the final call of a decision, but it is important to feel heard and to contribute to this. And they also would like to have an explanation. So why is the ultimate decision actually being made? What are the exact considerations that are taken up into the final decision? And I listed here some possibilities to collect these needs and the priorities. So for example, we have seen some discrete choice experiments, which is more of an online method in order to collect priorities that citizens have. In the Netherlands, there have also been a societal impact team established also to advise the government on COVID-19 management. And you can also think about more of deliberative processes. So then you go further into detail about the consideration on certain elements of COVID-19 management. That is also something that we want to do in the final project within my PhD. So we want to do a mini public or a deliberative process workshop to collect the considerations of the public in implementing control measures in new hypothetical outbreak scenarios to see what their considerations are and if that does have any added value to the considerations that we heard up until now from the public in COVID-19 management. So with this final project in prospect, I would like to end my presentation, and I hope I have inspired you to maybe new information, maybe a new perspective that you have gained, or maybe that you can take away for for the group discussions tomorrow. So thank you for listening.
Beautiful presentation and a very good work in this. Might be some questions for clarification. Yes, please.
Thank you very much, Sophie. Morning, Ireland. I guess I'm very interested in this piece, given we've had a very difficult 3 years where all of our countries have had to work together. And I'm interested in the WHO governance framework. It's all about governance, isn't it? And they talk about transparency, accountability, participation, as well as integrity in their decision making, and then having capacity. And just to mention, in Ireland, I think we had very good public engagement, very good immunisation levels very early on, for COVID-19 and we're an exemplar. I think it would be very interesting if you to look at good practices and how the public will work around. You know, we have people queuing for literally a mile to get into a vaccination centre early on. So I think there's richness there in seeing what went well, why, and so the teasing out the behavioural insights into it is very, very rich and very interesting field, which will be help us in the future. University experience will be key. You want action, you want change, and you want to deliver a message that people accept.
Yeah, thank you. Yeah, I think that's indeed very important to look at look at good practices, and that is also what I would like to do in the discussion of my thesis. And I think that's also something that public health professionals really need. So, what are the ways that we can engage the public, and who has certain good experiences with that, so we can also use that in our country, for example. Yeah, thank you.
Okay. Well, no other questions. Maybe tomorrow in the group discussions it will come back. But thank you very much, Sophie. And then we have another presentation. And Sandra, you will share with us the results or your findings, and maybe also reflect a bit on the ones from Sophie, but that we can do during the questions as well. Thank you.
All right, so for my final presentation for today, I'll be focusing on a multi-country focus group study that we conducted with the aim of understanding the European citizens' perception of its role during the COVID-19 preparedness, response, and recovery. So, yeah, as Sophie has already mentioned, I think in general, we also have experienced that the COVID-19 had immense and at times all-encompassing impacts on our lives. All citizens' lives, ranging from personal lives, professional lives, healthcare, physical and mental health care. And the governments actually called for citizen participation at different levels, ranging from adhering to the lockdowns and public health and hygiene measures, but also the need to test and the need to vaccinate. So it was very clear from the beginning that the COVID-19 pandemic could not be fought without the help of all individuals inhabiting each country. So in the beginning, I briefly mentioned the idea of good governance, which advocates for the explicit citizen engagement as part of the democratic governance and in general democratic process. And in general, people tend to agree that yes, citizens need to be involved. But how should citizens be involved? How far should they be involved in the decision making, and how should this take place? And I think it's the idea is interesting, but the implementation is very difficult and perhaps not so successful in most situations yet. At least that's what some of the respondents in the focus groups thought. With this quote from one of the respondents, which I thought was quite striking, the person said, "I see the world as a chessboard where the important figures are ... and the rest of us are the pawns. In a chess game, the pawns are disposable. In a pandemic, the population is the one that is hit so hard at the beginning, in the middle, and at the end. And at the end, there are the consequences that we will have to pay for with work." So evidently, this participant thought there's not much citizen engagement going on yet, but the consequences of the pandemic is one that the average citizen has to bear. So then the question is, which role does the citizen believe it should have? So not necessarily what the policymakers think, not necessarily what the WHO thinks the citizen should have during preparedness and response, but the average European citizen, which role should they have? So what we did is we conducted focus groups in 4 different countries. So we're very happy that us from the RVM in the Netherlands could collaborate with our partners in Finland, Slovenia, and Spain to conduct these focus groups. Thank you also, Uti, for moderating some of these focus groups. So we conducted a total of 16 of them. Each country conducted 4 focus groups, where the focus groups were split up into 4 different age categories, namely 18 to 30, 31 to 45, 46 to 65, and above 65. The idea is that if there were very polarizing opinions based on generational differences or experiences, that at least every participant would feel comfortable to express them within their own age category. So we conducted the focus groups in the national languages, so in Finnish, Spanish, Dutch, and Slovenian, using a translated focus group that we had developed in English. The focus group lasted approximately 2 hours based on the focus group guides that we had developed, and certain topics were discussed, such as the participants' general perception of the pandemic, the actions that they executed and expected to execute before, during, and after the pandemic, their desire to convey their opinions or concerns during the pandemic, the actors that they felt were involved during the pandemic, and also more specifically which role they should have during the pandemic. After the focus groups were conducted, they were translated back to English, or they stayed in Dutch, where the transcripts were double-coded to find meaningful fragments of text which could say something about the role of the citizen. So using a series of quotations, I'll guide you through some themes that became evident as we coded and analyzed the focus groups. So the first one is the theme of the citizen as an information receiver. So in general, the citizens felt that they just were on the receiving side of a lot was happening. So the receiving side of a lot of information. At the beginning of the pandemic, lots of them said that there was a lot of information that was coming in, but they were also looking up a lot of information. They wanted to know what was going on. So some actively started, but there was also a lot of passive reception of information. But there was also this idea, and I think nearly every respondent stated that there was information overload and information saturation. And this was also this was a little bit complicated because there was also the fact that there was a lot of lacking information, a lot of inaccurate information, and contradicting information from different experts, whether or not they're really experts on the theme or on the topic. So there's one quote that I'd like to put forward where a Spanish participant says, there has been, or still there is, an excess of information. On the one hand, the politicians go with their information, and on the other hand, the scientists with theirs. And these do not usually fit well. I do not believe neither the statistics nor the preventing measures due to the confusion created between so much political information and so much scientific information that contradict each other. So they're receiving information, but they don't really know what to do with the information anymore because it's not only too much, but it's confusing and contradictory. Many of them also stated that due to this information overload, it had an impact on their mental health, and they actually started to avoid news. They started to avoid receiving information on COVID. So there's one participant from Slovenia who said, "It is true, the media are putting me in a position of great distress. I don't even read the news anymore, and it has been like this for months. I'm forced to avoid the news intentionally. There's news about it every 5 minutes. You actually visit their page to get a piece of information, but then you leave the page mentally broken." I think considering the different stages of the COVID-19 pandemic and also actually new information that was arising quite frequently with different expectations from the citizens, it's a bit worrying that some people avoid the news to the point that they also then don't read the information that would then be useful for their own well-being. Another topic that came forward is the relationship between citizens and the decision makers. So the participants referred to the ways that the government spoke to them, and also how the government spoke to them and what kind of information they shared with them. How did the governments treat their citizens? So the respondents explicitly stated that in general, they felt that the governments did not really treat them as full adults that could make decisions and that could critically think about the decisions being made. So, for example, one of the participants from Spain again said, I think there has been a huge lack of sensitivity when a very large number of people have died and were not told what was happening. It was preferred to treat people like small children. I think that the information has been manipulated, as other participants says, in a way or another, depending on the point of view of each person. I find it very shameful on the part of all politicians. So this is quite extreme, but there are many who said that they felt that they could have handled more accurate information that perhaps the government thought they could, especially in the times where it was unclear what the impact of the COVID-19 was going to be. It's also important that the citizens are really treated as people who can make decisions, because it does affect on their compliance to the rules that are being made or the suggestions that the governments put forward. For example, a respondent from Slovenia says, because if I feel I'm being heard, if I feel that I have a say in the matter, then I'm treated as an adult capable of critical thinking, then I'll also be more active and I will listen when something is asked, not demanded or expected. I think I'll be more prepared to become actively involved. So that is interesting, but on the other hand, I must state that there are also some citizens who stated, I don't really know what to do. I need to be told what to do. So I think it's also the method of communication that is more important. In the end, lots of citizens need guidance, need suggestions of how to deal with the situation during preparedness, response, and recovery, but they want to be given the idea that they're also being heard when they have something to say. And I think that is important, because the citizen needs to feel that their personal situation is taken into account. And if they feel like there's no method or way or channel to express it, if they don't agree with the measures, how do they proceed then? In general, I think perhaps Uzi can also state something about that, how she experienced it in Finland, but most participants in our focus groups were those that were quite compliant with the measures. We did not have those who denied the existence of the COVID-19 pandemic. We did not have those who said that they wouldn't vaccinate at any cost. So of course there's a specific bias to the opinions that we have. But even if those who generally follow the measures say this, it is something that I think we need to take into consideration. Then I think the last topic that came up quite often is that the citizens' perceived role, in the sense that the government needs to take into account the different perspective within society. They need to take into the fact that different society groups have different views and different realities. So quite a few participants said, yes, they're not the experts on the COVID-19 pandemic. They're not the experts in terms of epidemiology, in terms of virology, but they do know something about how the measures that are put into place, how the policies that are put into place will affect their personal lives. Many stated that they would appreciate it if politicians or those making decisions would walk on their streets to see how they are dealing with the effects of the policies being made. That being said, many don't know how to prepare for a pandemic. Many don't know also how to recover from a pandemic. So they do need the guidance from the politicians to make certain decisions, to kind of keep up with everything that is going before and after a pandemic. So one of the citizens says, I have to say, I can't, off the top of my head, say that I would have been somehow prepared or even know how to prepare for something like this. That would have required opportunities for remote work or food storage, or how I could get around differently. I wasn't prepared in any way, or didn't even know how I could have prepared. So in this case, many citizens didn't really see a specific role for themselves during preparedness and response. Many said there are experts that have the knowledge, that are being paid, that have the time to deal with this. I don't know what to do. I need to be told if I can contribute one way or another. If I can even contribute one way or another, because that is also something many said. You can prepare for something that you don't know. But I do think you can recover from something, so like the COVID-19 pandemic. Those who did give suggestions about how to recover, they're mostly financially. So many said, I'll go to a restaurant, I'll go to a concert to help those that didn't have income for some time. And lastly, the citizens did have a more clear idea of their role during the pandemic. And like I said, our participants were quite compliant, and they felt that their role was to follow the measures put forward by the government. They say that they have a social responsibility to not only take care of themselves, but also those around them, to show solidarity and to really try to make sure the COVID-19 pandemic would end as quickly as possible. So this was put forward in a quote where the participant from the Netherlands said, there's a personal part and a societal part. Personally, I adhere to the measures. I have really thought about whether to get vaccinated or not, to take my societal responsibility. So I think, yes, they do see their role as following the rules, but they do think about it. They do really try to weigh the pros and cons for themselves and have clear argumentation for why they make the decisions, yes or no. So just simply giving them orders of this is what you have to do during a pandemic, I think that doesn't really work for all citizens. This is a quote from the Netherlands, and I think many of us heard it many times. One of the citizens says, everyone has an opinion. And you see that in football too. There are 17 million national coaches that all know better. Now we have a lot of epidemiologists and virologists in the Netherlands who all know what is best. So on the one hand, there's one participant saying that he feels that he's being seen as a disposable pawn. And on the other hand, there's this participant saying that all of us, all residents, all know better. I think the answer is somewhere in the middle, and I think that's also what was shown during the study. We all don't know better. There are people who have expertise. There are people who have studied for this. There are people that really have the knowledge to help us or to guide us through a pandemic. But I really think that we shouldn't ignore the citizens. We shouldn't ignore their feelings, their personal experiences during the pandemic as well as before and after. Many citizens do follow the rules, but I think they do have to be given the opportunity to state how the preparedness and response can be improved to better fit their situation. Thank you for your attention. Are there any questions?
Any questions? Yes, Sophie.
Yeah, so at the beginning we talked about the relationship between citizens and decision makers. Did you find very big differences between the countries?
Yeah, there were some countries that were more negative about the relationship between their governments and the citizens, that they really felt that they were being treated like children, or at least they were more vocal about it. But in general, because there were countries that were more vocal about it and saying, yeah, we're being treated as children, but there were other countries that were saying, we are critical thinkers. I can also make decisions. I can also make up my mind. So I think it's just how they expressed it. But in the end, the idea is that, yeah, the average adult also has something to say about how their life is being led.
Once again, I think it's a remarkable study. There's such a lot of powerful themes coming out of this. One of the questions that I caught my attention, one of the quotes that caught my attention was, citizens felt that they needed to be treated like adults capable of critical thinking. That is the real crux of the problem. How do you assess your population, whether they are that or not, whether they are capable of adults capable of critical thinking? Because I grappled with this issue for 2 years as the incident director of COVID in Wales. The average comprehension in the Welsh population is that of a 13-year-old. So, and now we compare that with critical thinking, and we talk about effectiveness of mask wearing, for example. That's not a message that easily goes down. So, how do we tackle that? How do you assess your population's critical thinking ability?
That's a very good question, and I think it's a difficult question. Of course, those that participate in our study are also those that are interested in thinking about this kind of research, those are interested in thinking about the COVID-19 pandemic. So perhaps it is safe to state that these are people that would also be more likely to think critically. Even if your whole population cannot think critically, there are still people who can have quite I think that can also be a significant part of the population, but that can also create specific groups, which I think is really interesting in the study that Sophie did, that can mobilize other people to maybe go in a direction that the government does not necessarily want. So I think you do have to provide information, perhaps at different levels, for those who don't need so much extra information or just need to be told, okay, this is it and this is what you need to do. But perhaps you do need to give information for those who want more explanation about why are decisions being made, and what the impact would be on their lives, so that everyone in the population feels that the information that they're receiving is in line with their personal situation. But it's difficult. It's easier. I think from a communication perspective, it is a very difficult task, but I think it is one that is relevant in all policy making.
But I think we also already did during the COVID-19 that we both addressed people. But you said, well, we have to give information on websites with short lines on a certain language level. We are always corrected that it is too hard language. On the other hand, we also developed into more content-wise added communication. So to have a different scale or different, how do you say, different attributes and different information and towards what people need or want or looking for. And that's what from my experiences, this during the COVID was this for the first time that it was so much differentiated on purpose level. And it was all, that is what I look maybe how this was in the UK, but.
You realise it's complex. What COVID did and what any emergency poses is the dynamic nature of the information available at any given time. It moves so quickly. So having that really solid communications infrastructure and understanding of how different segments you're describing, different segments of the population, they think or feel in different ways for different reasons. So you have to segment your campaign messaging to actually meet their specific information and needs. It's not easy, and that's why sometimes I get frustrated when people say, oh, comes people, they just post social media and it is actually highly strategic, and it's a big challenge. You've got me on my favourite subject, so I'll shut up. If you're interested, there's some very good information on how it's done on the UK Government Communications Service. There's a lot of resources there if you're interested. Come up to me. Thank you.
I think
Okay.
the other question, yeah.
There's one point. The issue of the university for France in general is that presenting facts that change is difficult, and I don't think it's probably there's a critical thinking of the population, but when you're presented with changing facts, but every time you say authoritative view, I don't think but it's quite understandable to be frustrated in a way. Difficulty from a risk communication is presenting facts that change or understanding of facts that change, and it's not so much a question of a capacity of critical thinking of the population. I think by definition we have, and we do accept that people vote. So if you have a capacity for critical thinking, we accept, we accept that, but it's not surprising that they can be frustrated when presented with essentially completely contradictory facts, which is normal, just understanding change, but presented in the same authoritative view and create some misunderstandings.
Yeah, I think so too. Not only the facts, but also the presentation of the measures taken, and sometimes with not always very coherent explanations. I think that is part of the problem as well.
The other issue was common theme in terms of risk communication is that we need to present things in simple way, sort of perhaps underestimating, but perhaps critical thinking. So we tend to oversimplify, or we tend to not communicate uncertainty. Hence, we have simple messages, and that simplicity in itself creates a misunderstanding. And I think when you have changing facts, then that having simple messages is not conducive to appropriation of those messages when the messages change.
Yeah, thank you. That's true.
Okay, Karen, last word for you for this session.
I'm happy to set up, and anybody else has got a question. I just wanted to raise the issue of the trusted voice in communication. And in many, if not all, member states, you have the government driving the messaging, and yet it's the public health experts who are most respected. I think that's been proven in Wales, that the trust and awareness of certainly our own public health institute went up enormously during that time. And the criticism on messaging and the distrust or skepticism of the members of the general public and
Yeah, there was a lot. Yeah, there were a lot of criticism, or at least not criticism per se, but skepticism about politicians, the politicization of the situation, the centralization of the situation. But I must say, another sector that was also quite negatively portrayed during our focus group was the role of the media. That on the one hand, they provide information, but they sensationalize it, put forward talk shows where they put together experts who sometimes aren't really experts, but who just with the idea of getting people to kind of argue with each other, to contradict each other. So that's also one thing that one sector that, that the participants were not so positive about. Although I do think the media played a very important role because they sometimes provided us with information before the politicians did.